the Pet Health and Happiness podcast from Bella+Duke, keeping you at the cutting edge of pet nutrition, behaviour and health with expert interviews, mythbusters and more to help your pet lead a healthier, happier life.
Welcome everybody to this week's episode. My name is Rowan Sanderson. I'm the CNO, Chief Nutritional Officer here at Bella+Duke, and this is our good friend and super vet, Dr. Brendan Clarke. Dr. Brendan Clarke, welcome.
Good morning. How are you doing?
Awesome. All the better for seeing you, Brendan. And this week, we are going to be covering everything you need to know about spaying your doggo. Now, this is a really important topic, and in the wave of puppy ownership, which has been sweeping the UK in 2020, everybody seems to be coming to that incredible decision point of to spay or not to spay. So this episode is dedicated to helping you make an informed decision. Brendan, thank you for joining us. This is actually quite an important topic and never one to be underestimated. So tell us, what exactly is it when people say spaying?
So to spay literally is to neuter a female dog, so a bitch, as we would call in the UK. So the process very much is to do an operation to remove the ovaries all the way down through the uterus to the cervix, and remove all of that is a classic spay. There are some alternatives, and we can talk about those going forward.
Okay, so spaying relates to a female dog and castration is to the male dog.
Absolutely.
Right, because I've seen, especially in our group, people seem to use the term interchangeably for everything. So spaying is female specific.
Yeah, I think the complexity comes because of the whole use of neutering, castration, spaying, vasectomies, all of that sort of gets a little bit mushed up and lost. Neutering is literally the removal of gonads in male or females. Castration is specifically to males, and spaying is specifically to females.
Okay, so there are different types of spaying available. Can you talk us through the different types, please?
Yeah, well, let's start with the classic. So the one that I was taught when I was at university over 25 years ago, is one of those that was in place probably from the mid-50s, where a professor at the university was sort of saying this is eulogizing about the benefits of neutering and reduction of unwanted puppies and that side of things. So what we ended up with was a classic spay was a midline incision about halfway between the umbilicus and the pubis, the front of the pelvis. A relatively small incision can be made, but depends on the expertise and experience of the vet that's doing the operation. That may be extended, so that I've seen wounds that can vary from a centimetre up to 5 inches. So it really depends on what the procedure they feel they need exposure for is. And that classic spay would then remove everything from above the ovary, so just behind the kidney, right the way down, including fallopian tubes, uterus, down to the cervix, and they would tie off through the cervix to stop any vascular bleeding at that point as well, and remove that, suture them up, and that's your classic spay. Okay,
so that's option one, I guess.
Option
we'll
one.
Call that the classic.
Yeah, absolutely. So the options that have come about following that is you will have heard of laparoscopic spaying.
Okay.
And because some vets were creating larger and larger wounds, and surgeons have this crazy feeling that, well, the wound heals from side to side, so I can create a large wound, it's going to be fine. From a person who loves to make sure that our animals are pain-free, I would say that every centimetre you incise, that's another million neurons that your sensory cutting through and possibly inducing more discomfort. So why are we creating large wounds? We should be creating the smallest wounds possible. And pretty much laparoscopic spaying takes a principle of creating a port, so a small centimetre wound to pass a camera, and then another port to pass an implement through, and another port usually to inflate, deflate, or look at a secondary instrumentation into the abdomen. So you usually end up with 3 ports incised into the abdomen. To do that procedure again can be to take everything from the ovaries down to the cervix and remove. There's some little nuances. Some people will just take out the ovaries alone. Some people will take out the uterus and one ovary. But ultimately, laparoscopic spaying is about reducing incision size and reducing discomfort from stretching ligaments, etc., in the process of doing the operation.
Okay, can I just jump in? Sorry, Brendan.
Yeah.
So when we're talking about laparoscopic, is that what most lay people would understand as keyhole?
Yes. Yeah.
Okay. So for those of you listening at home, I'm guessing, just teasing apart all of these great facts, is there's the classic spay using classic methods. Keyhole can actually facilitate all the different methods. It's just the method of doing it.
Yes, absolutely right. And I think ultimately it comes down to incision size. Some people will say it's about stretching the ligament for the ovary, all of those sort of things that could induce discomfort, how to avoid that. I would say, talking to people that have had keyhole surgery, my brother's a surgeon who does laparoscopic abdominal surgery as well for humans, and having family members experience as well of those that have experienced keyhole surgery, is the inflation, usually with carbon dioxide of the abdomen, can leave them with other issues, other discomforts. It's not necessarily, absolutely brilliant gold standard, no problems. They can have other things to look at with subcutaneous emphysema, that's a gas building up under the skin, or indeed abdominal sort of feeling a little bit wobbly tummied because you've got a lot of gas left in your abdomen after the procedure. So It's a conversation, an informed consent, as you said earlier in this conversation, that you must be talking to your vet if they're talking about these other procedures as to whether that's right for your dog. Okay.
Now, thank you for that. I can see there are lots of people, and as said, puppy ownership in the UK this year has gone through the charts for whichever reasons. Our goal here is to give people the facts so they can make a really informed decision and tease apart what is a bit of a minefield. And as we've already seen, the very terms themselves can be mishmashed, whether it's spay, neuter, castrate. So apart from the classic method and the means of doing it laparoscopically or with keyhole, what really are the alternatives facing people, and what should they be engaging their vet in terms of a discussion with them? What should they be asking, and why would people want to look at the other alternatives?
Okay, so there's a few things to talk about with regards to the neutering methods, and I would still say last point is that there are some vets out there, our practice has been trained to make sure that incisions can be kept to literally 1 to 2 centimeters tops incision, and that means that you are creating a single keyhole rather than 3 and actually still achieve a neutering through that hole. Okay, so it's certainly possible to do that, and so that puts to bed the surgical methods of approach. I think the other then conversations that have been had, and there's been a lot of reviews made. One of the upsides to having corporatization of certain veterinary practices in the US has been that they've been able to review all of their clinical data as to what's going on with prevalence of certain disease. And, we look back as a profession and go, oh yeah, we've seen that overall, but we've never been able to draw the strings together. And that's things like joint disease, the number of cruciate operations that we're doing these days compared to what we used to be doing. The number of, that's a disease of the knee that can, with ligament breakdown, classic footballer's injury. But it is something that we've been seeing a lot in our larger breed dogs. Joint disease. So, a lot of times we've been talking about it's down to nutrition or it's down to, the breeding genetics. But what we've seen is that there's a lot of influence of hormones within joint disease as well, and the growth factors and how they grow, and maturity of skeleton and everything else. On top of that, they looked actually at some of the devastating cancers that are out there. And so one of the original reasons, the benefits of spaying was actually to reduce cancer. It was there to, we can take out the ovaries, so therefore we're not going to get ovarian cancer. We can take out, the uterus. We're going to get rid of all of the, uterine cancers. We can also have an effect by removing the hormones, reduce mammary cancer. Okay, the big C for many, many humans is mammary cancer, breast cancer. But in dogs, the majority, 80% of mammary cancers are actually benign. So once removed, that's the entirety removed. And they're very visible on the outside. So there was that whole thing about, well, it's anti-cancer, we can remove it. But actually, on reviewing, and this was a great review done by the University of Davis over in the States, and they looked at the effect of neutering early and neutering after puberty, and actually showing that neutering early can have devastating effects, increasing cancers such as hemangiosarcoma, that's splenic blood vessel tumors. There's osteosarcoma, that's a tumor of the bone, and lymphoma, that's tumors of the lymphatic systems, all the way through to even transitional cell carcinoma, that's a tumor of bladder lining. Those are actually, rather than benign and being able to be removed, they have a devastating risk to your pet's health, really life-threatening. You've got survival rates of 30 to 60 days, some of those even with treatment and surgery. So actually, we can see that actually if we leave some hormones in the system, massive reductions of those types of cancers.
Okay, so just to jump in there, Brendan, what we're actually saying is the very reason for spaying, apart from potentially the practicals of, I don't want my dog to have babies, puppies, or I can't be vigilant enough to ensure she doesn't get pregnant, or for whichever reasons, above the pragmatics, the motivations behind spaying to avoid cancer may, in fact, if done too early, be creating more dangerous cancers because of the lack of hormones. Indeed.
And we're looking, the study in Rottweilers was literally showing that if you neutered a Rottweiler bitch early, you escalated her risk of osteosarcoma from being around 10 to 15%, okay, just genetically predisposed, up to over 25%. So that's 1 in 4 bitches that are neutered early would be predisposed to osteosarcoma. Wow. For males, it's much worse. It's around about 9 to 10%. You neuter them too early, and it escalates up to 27 to 28%. So nearly a third of males, so 1 in 3, would be predisposed to osteosarcoma if you neuter them too early in
Wow.
Rottweilers.
So you're tripling the risk. You're tripling the risk.
Yeah, and not just tripling a risk, but tripling a relatively large risk too. So this is not the I'm going to take a birth control pill and I'm going to increase my risk from 0.01% of breast cancer to 0.05% of breast cancer. This is, which is a huge leap, okay, but it's still a relatively small percentage that you're increasing it by. This is actually the reverse in this sense with neutering, is increasing a relatively large predisposition to an absolutely ginormous predisposition. This was actually presented at the World Small Animal Veterinary Association back in 2017. Because in Europe, there's many countries that will not neuter at all unless there's a clinical reason, because they think it's an impingement on the welfare of the pet.
Wow. Okay, I knew this was actually a minefield. I wasn't quite as aware, or quite aware enough, of just how devastating the statistics are from spaying too early. Now, as a cautionary note and as an aside before we press on, there'll be lots of people out there who have actually maybe watching this and have bought a puppy and brought it into their life and fallen in love with it, the puppy arrived from the breeder already spayed or castrated. Now, just as a note, please avoid panicking. This does not mean that your puppy is going to be ill, especially not if you're going to raw feed it and go for regularly veterinary checks. You're already down-regulating cancer risk with raw food. So please, and I'm not really supposed to say that, but I believe it. It's my opinion. And I think lots of open-minded, experienced vets would agree with me, but, I'm not going to stand up in court on that. Well, maybe I will, actually.
I think the other reassurance is, in the UK, okay, halfway between Europe and the States in their thinking, I think the likelihood of early neutering, so that sort of puppyhood neutering, so really young, pre-12 weeks, is really, really rare. Okay, it's been advocated in the States, but certainly in Europe it's not a big thing, and certainly in the UK, many vets will advocate that you at least let one season go by before you neuter. So I think for the majority of you, it's really unlikely that you're going to have a puppy with you right now that's already been neutered by the breeder.
We've looked at the different surgical methods, and thank you, that's really thrown light on that. And I think it's really important for everybody watching this to feel like they're empowered to ask some sensible questions when they get to their vet. Quite often people get in front of a medical establishment, shall we say. I know when I'm looking after my parents, I say to them, okay, so what did you ask the doctor? And, they freeze. And I think what we'd like is for people to have a couple of key questions to ask their vet to get reassurance that they're doing the best for their dog if they're going to spay at all. So we've covered 3 different potential surgical methods. We've covered the differences between spaying, neutering, castration. We've covered the reasons why you would consider, shall we say, spaying, neutering, or castration. And realistically, that it should be at least 1 season in if you are going to do it. Can you tell us, a lot of people are asking questions about ovary sparing spays and various permutations. Shall we have a deep dive into what are the options and why you would consider them?
Okay, so ovarian sparing spays is very topical, especially on the back of those studies I talked about earlier. And that effectively is just modifying the procedure to leave behind one of the ovaries. That is sufficient hormone to have all sorts of interactions on the rest of the body, to allow maturity of the skeletal system, to allow for the interaction with some of the hormones within the brain, so you don't get a runaway with the TSH, which can stimulate more cancer cells and things like that. So there's all sorts of things that can be controlled, including the strength of the sphincter of the bladder, so reducing the risk of incontinence in later life. So just leaving one of the ovaries behind. So when you go in, you can have a look at each ovary. Usually we do right ovary remains, but if there's a cystic ovary or whatever, you will look at that and you'll say, okay, I'll remove any signs of disease and leave a healthy ovary behind, notifying on the clinical record which ovary that is in case of future issue.
Okay.
And so there are some vets through the UK. Certainly, look, there's a Facebook group. If you search for ovarian sparing spay, if you look at the BAHVS, so the British Association of Homeopathic Veterinary Surgeons website, so bahvs.com, they have an article on it and a listing of vets that will go through that procedure. Persimmon, which is a US site, also does the same thing. So lots of resources that we'll post, I'm sure, through Bella+Duke with their information pages about these procedures and the pros and cons. But absolutely, you're right. You know, if you want an in-depth discussion with your vet, you know, have a little read of this information. Talk to them about, you know, the studies, the most recent studies, why they're doing the procedures they're doing, okay, and what they feel the pros and cons are with regards to that, and, you know, make an informed choice about the risk of anesthesia, the risks of the operation itself, and the removal of the gonads, and whether that's right for you and your pet in your situation.
Okay.
That can be breed related, it can be circumstance related too.
And guys, Brendan has very kindly shared a raft of references from the Raw Feeding Veterinary Society. I suggest you check them out. We will put a link to the RFVS in the show notes. Please go and give them your support. They really need it. But we will also share those references in the show notes so that you can have a deeper dive. And if you want to print something off and show it to your vet, and just ask them. You know, most vets are very, very responsive to informed decisions, and they want to support you with that. And if you go and ask them about something specifically, I'm sure they'll be really receptive to that, won't they, Brendan?
Yeah, absolutely. That'd be great. If you want to follow that through, as I say, there's a number of holistic sites that also would be grateful of your support.
So, Brendan, as ever, and whether it's a combination of your beautiful big brain or raft of experience, despite your relatively young years, you are very, very measured and sanguine and always bring an extra perspective to the party. And you rightly pointed out, I believe, that this, whilst it's a common operation, it's a little bit more than a, shall we say, routine operation, and it is something which is elective. What are the extra considerations that people should throw into that mix when making this decision?
Yeah, I think, look, you've got to understand this is a really important decision, and it's going to be based around what breed you have, you know, how old they are, what your personal circumstances are as to whether neutering is right for you and your pet. And, you know, there are some situations where you may be in the middle of nowhere, your breed is low risk for some of those other considerations, like infections of the uterus, cancers of the mammary glands, the issues around joint disease, that you might just think, do you know what, I'm not going to neuter because, you know, I'm not at risk of having unwanted puppies in the household, and they're going through a normal life cycle of going into season every 6 months, and behaviorally I can cope with that. She's not having false pregnancies, so therefore I'm going to cope. or you may have to be in an urban situation and you've got to make those decisions because it's just totally unsociable to have a bitch on heat creating mayhem through the neighborhood, and therefore you've got to make that. So when you're making that decision, have a conversation with your vet. Don't just look at the cost, look at what your vet offers. You know, one practice, you're going to be giving an anesthetic. This is an abdominal operation that requires an anesthetic. So that means that you're going to be putting your beloved companion under an anesthetic with medicines. Now, for humans, there is a risk rate quoted of about 1 in 10,000 of an adverse reaction to the drugs without any fault of anybody other than that's just nature of giving these anesthetic drugs. And similarly, that carries through for dogs. In fact, the reaction rates are quoted as slightly higher just because of the types of drugs we use. So have a conversation about which drugs they're using, what their experience of reaction rates are, what monitor situations they're having. So one practice may have a vet and a nurse or an assistant, okay, just another person within the practice looking over that patient whilst the vet is operating and in control. Whereas another may have all of the bells and whistles monitors, qualified members of staff watching the anaesthetic whilst the vet is operating as well. And that will have an impact on yes, the base cost, but also the safety of your pet being under an anaesthetic in those circumstances. So ask those questions about how they are managing your companion through that hospital period, so that you are aware of the procedures and what the safety is for that procedure.
Okay. I think that's a lovely summary, and really, I guess, brings us to the end of this episode. To recap, when you're considering this, first and foremost, do you actually need it done? Is the breed of your dog, the location of your home, is it really dictating that you need to have this operation? If so, do you want to wait at least a couple of seasons? And then the various forms of operation that can take place and how they actually, shall we say, perform that. And then what is it exactly that they do? So there's lots of moving parts here. It's not as simple as surrendering your companion, as you rightly call them, to the vet, blindly trusting. Here are some great questions for you to ask them.
Great. That's great. Thanks, Rowan.
Okay, Brendan, thanks again for another superb episode. It's always a pleasure to hear your thoughts on this. I personally am super enjoying it. We're getting great feedback and I'm learning something every week. So thank you for your time. Please feel appreciated and valued.
Great. Thank you.